Good afternoon. My name is Bobby Bohack. Welcome to my collaboration and reflection video for NURSFPX4010, Leading People, Processes, and Organizations in Interprofessional Practice. During this video, I plan to reflect on interdisciplinary collaboration experience I had personally and the ways in which it was successful and unsuccessful. Identify how poor collaboration in the Villa Health scenario led to ineffective management of both human and financial resources. Identify best practice leadership strategies from literature which the management in the Villa Health scenario could have used to improve their team's interdisciplinary approach to better achieve their goals. Identify best practice interdisciplinary collaboration strategies which could help the team in the Villa Health scenario work more effectively together. And I'll make mention of the authors from the literature. My interprofessional collaboration experience. As an acute care dialysis nurse, I work full-time for one company while dialyzing patients in various hospitals which that company is contracted to. We are guests in other facilities, so to speak. This creates a unique chance as well as unique challenges to foster interdisciplinary collaborations with the staff of the hospital where these inpatient dialysis units are located. Recently, we noticed that wait times to receive patients to be dialyzed were becoming considerably longer than they should be in one facility. Typically, we would call the floor the patient was on, receive report from the nurse caring for that patient, and then within 30 minutes, they would have transport dropping the patient off to be dialyzed. However, it was becoming more common to experience wait times of an hour or even more after receiving report before the patient was brought to us. A lengthy wait time may alter my plans for my shift and be inconvenient, but for the patients, the inconvenience affects the care they receive as well as the status of their health. Comments had been made to us where floor nurses expressed the opinion that dialysis was not a top priority, among other remarks. It was clear that education needed to be provided and that it would need to come from their facility and not us as individuals, as our previous attempts to explain the importance of timely transport continue to be ignored. By taking our issue one step up to our facility administrator, who then spoke with our hospital services administrator, they were able to approach the hospital liaison for our program with the problems we were having. The hospital was then able to educate staff during pre-shift huddle times on the importance not just for the dialysis nurses, but all areas needing patients transported to receive them in a timely fashion. They were able to educate their staff on the fact that appropriate timing enhances patient care. This was a success, as we have since noticed much shorter wait times to receive our patients. One issue the hospital staff brought to management's attention during this was a lack of actual transport staff. Due to budget constraints, the transport team the hospital previously employed had been phased out. This left nurses and patient care technicians responsible for transporting patients. While the request was made to bring back transport teams, this has not been implemented. In my opinion, this aspect of the collaboration was not successful. Perhaps they intend to put a transport team back in place and have not done so yet. This collaboration between two companies and the management and staff of both would have been just a bit more complete if they had included more help to get the transport done. This experience showed me that taking time to reflect on the root cause of a problem can help to define a solution. As discussed in an article written in 2019 by Ardian et al., the 6 steps of reflection used in the Graham-Gibbs reflection approach and a, quote, straightforward reflection, comprehensible and structured by involving emotional components and nurses' way of thinking in overcoming past occurrences, end quote, proved to be an effective method in tackling this issue for us. By reflecting on the complaints the floor nurses had, we were able to approach our managers with the information that they needed to provide the hospital staff. The hospital staff was able to reflect on what would help them improve their timing and present that to their management. Addressing the emotional aspect and frustration staff had head-on before the issue became worse led to a mostly comprehensive and prompt resolution of this issue. Poor collaboration at Villa Health and the effect on human and financial resources. The collaboration at Villa Health fell apart beginning at the corporate level. By mandating they implement a system that is designed more for a hospital than a skilled nursing facility, then sending in an implementation coach that was unfamiliar with the facility and staff, corporate managed to set a very poor tone for the rollout of Healthix at Villa Health. Had they instead allowed Administrator Silva to work with his IT manager Chad Cook and find a system that best fit the needs of the facility, it might have been a start towards effectively collaborating. Instead of sending in a stranger from their corporate offices to coach staff during the rollout, reversing the script and sending a delegate from IT and a delegate from the nursing staff to learn the new system, then bring their fresh knowledge back to their coworkers might also have been a better idea. Issues like this take an emotional and financial toll on a facility. Both the IT department and the nursing staff have expressed their aggravation with how the situation was handled. Several nurses specifically make mention of how the frustration with the new system has led to hurt feelings, and the bitter tone implied when HealthX is discussed does not make it sound like a content and happy work environment. The nursing department specifically has mentioned how much of the HealthX system is useless to them, as they may see a dozen or more tabs to choose from on a screen and only a few apply to their residents when they go to chart. The system, even at a bargain obtained by corporate, sounds as though they paid for more than they truly needed in the facility. The wasted time the staff spends navigating a convoluted system can be equated to wasted dollars as well. Best practice leadership strategies. Starting at the corporate level, collaboration at Villa Health could be improved upon if they followed Kurt Lewin's change model. There are 3 basic steps to Lewin's model: unfreezing, change, and refreezing. The resistance to change at Villa Health signals that they are having problems with this initial step of unfreezing. As described by Hussein et al., quote, successful organizational change may be planned, and this requires the system to be unfreezed, end quote, written in 2016. Better collaboration would have fostered better attitudes towards unfreezing from their current system and turning to embrace the new records system at Villa Health. Encouraging more employee involvement during the change phase, which would be the rollout of the new record system in this scenario, would have garnered the most cooperative response from the staff. As described by Hussein et al. In their 2016 article, quote, for overcoming the resistance in organizational change, employee involvement is the oldest and most effective strategy in formulating the planning and implementing change, end quote. Had corporate chosen to include the staff in more of the decisions around implementing the changes needed, they could have further saved effort and money on the change needed to make the new system productive. The final step, refreezing, occurs once the change is in place. With time, the staff hopefully refreezes into a new normal routine of using the record system. By not using a model such as Lewin's change theory, corporate has left the staff behind to struggle with the refreezing phase. The frustration due to ongoing issues with the way the system operates and a continued lack of training and support from management could have been prevented. Best practice interdisciplinary collaboration strategy. Now that HealthX is in place and the staff continue to struggle to adapt to it, the administration at Villa Health could work to improve the situation there by embracing a systems thinking model. As described in the 2017 article by Murray and Bellinger, utilizing a systems thinking approach to solve the problems in an organization requires an understanding of the interactions taking place. Administration has already noticed that the situation with HealthX continues to need improvement. If they would look further into what issues exist and how these issues are affecting the staff, then Administrator Silva and his team could implement a systems thinking model, such as the 6 detailed in Murray and Bellinger's article. Specifically, systems of the mind would be a good place to possibly look to start. Divided into the levels of deep structure and surface structures, this model helps to encourage a change in thinking and working habits. Murray and Bellinger, 2017. Reinforcing, encouraging, and rewarding improved performance as employees become more proficient at HealthX might slowly begin to point the staff back towards the level of teamwork they once had. If staff understands their proficiency and willingness to assist others with becoming proficient will be rewarded, then the animosity that is felt when fellow nurses need help on the computer will slowly begin to melt away. Conclusion. Utilizing techniques such as Lewin's change theory, a systems thinking approach, and reflection enhances the efforts of people to come together as a team to reach a common goal. These skills can be carried from one job to the next as staff advances in their careers and even into their personal lives. While there will always be challenges anytime people come together to reach a goal as a group, the proper planning and implementation can make interdisciplinary collaboration in healthcare settings more effective and a positive experience for all involved. Thank you, and have a good day.